Viewers, welcome back to IPC with Nikki. How are we doing today? It's been a very busy period at my end. I hope you're all doing well. So today we'll be talking about another important issue in the life of an infection preventionist, and that is getting getting interviewed for infection preventionist role or infection prevention and control practitioner role, irrespective of your level, either a novice, an intermediate, or experienced infection prevention and control practitioner. There might be times you need to change your organization, environment, or go for higher roles in the field. So today we'll be discussing, and you're free to comment, you're free to share your experiences or experience on what you've encountered in being interviewed for the role of infection preventionist. But before I go further on that, I am excited to let us know that soon we are going to be having flashcards ready for infection preventionists who are preparing for their certification exams before the year ends. That's good news, right? I know. So tell your friends to subscribe. So whenever these flashcards are available that can help them to prepare, they can be informed as soon as possible. So watch this space. As I said earlier on, today we'll be discussing on how you can dot your I's and cross your T's when it comes to being interviewed. I've been in a position, and I'm still in a position where from time to time I apply for some roles and I get interviewed. And I've also been in the position of an hiring manager. I've had to interview persons in the field of infection prevention and control. So I will be combining these experiences, and there's no one shoe fits all. I can tell you that, but these are some things that has helped me in my years of practice, and I'd love to share with you. Please feel free, as I said, to share in the comment section. So first of all, if you're interested in the role of infection prevention and control, we've mentioned earlier that it's very important for you to do your homework, getting the appropriate education and resources you need, and also getting certified or prepare to get certified as required by your employer or as policy states. Okay, so the place of preparation cannot be overemphasized. Always be ready, you never know. Even if you haven't gotten that role yet, you haven't gotten the position you want yet, always put yourself in a place where you're ready. So whenever that opportunity comes, you can go for it and you're prepared. Okay. So first of all, in most situations, hiring managers usually request for two stages of interview. You have the first one, which is usually a screening process. They want to know who has shown interest in their organization or in the position. So, and usually this is true. Okay, looking through your resume, just having a general knowledge of who you are and what your values are. So the range of the questions that could be asked can go over different depending on the organization and what the hiring manager is looking for. But some of the typical questions are: one, can you tell us about yourself? Almost every interview, or if not all interview I've attended, started with who is Adenike, or can you introduce yourself to us? So it's very, very important. I know that getting invitation for interview can cause anxieties. You're not sure of what the end result is, but it's very important for you to practice. What I do that helps me is I practice over and over. Sometimes I talk to my kids, and I use imaginary manager. I set up an imaginary right in my presence, just to make sure that I feel that presence and I prepare myself. I know what to say. I don't stumble on my words and things like that. So I practice over and over. I still do it. So that's the truth. So one of the things is ensuring you practice how to introduce yourself. So introducing yourself, you want to give the most information about you that you want your employers to know, that makes you a fit for that role, but at the same time, not too worded, not going round and round and making people lose interest. So first impression really matters. That's my opinion about how you present yourself. So you can have questions like, who are you? Can you introduce yourself to us? I'll give an example with myself. I can say something like, oh, I am Adenike Oguntimeyin. I have 10 years experience in the healthcare sector and about 5 years in healthcare leadership. I've worked in areas of laboratory medicine, public health, and infection prevention and control. I'm currently in I'm currently in a leadership role in infection prevention and control. I have experience and skills in communication, interdisciplinary practice. Just highlights. I've won an award for and just like that. Just state out your qualification first. Mention your qualification. Mention your skills. Mention your experience. Mention, not in depth explanation. And then at the end, you say, oh, all this, my background and experiences and skills have prepared me for this role of infection control practitioner. So it doesn't have to be exactly like that, but I think you understand what I'm trying to say. So don't put too much words. Don't go round about too much. Make sure you highlight your educational or academic qualification, your skills. A lot of iron managers are looking for soft skills, communication skills, leadership skills. Just mention them, highlight them. Of course, if you're asked to expand or explain further, then you can go further. Just highlight them, your skills, and at the end of the day, make sure everything you have said, you direct it back to saying they prepared you or made you to be the best candidate for that role. Okay, so that's a general question now. So the other thing also is you could be asked questions like, okay, scenario questions, okay, like conflict resolutions, so many other questions. So you can try looking at some interview examples. You have a lot of them online on those general questions. So, but the other one I'm going to stress a lot, it's on the technical questions, which is sometimes it might be a round two interview, or sometimes some hiring managers, depending on the time frame, might just combine the first and second stage. Okay, so there is also a technical aspect of the interview sections. So for this technical aspects is solely dependent on your knowledge and experience. So especially for novice infection, this can be very tricky because you've not had that experience. But not having that experience, um is not something that can stop you if you have done your homework. That's what I realized. Okay, so for example, being interviewed for infection preventionist role, you should know the basics of what is expected of an infection preventionist. Okay, when it comes to professional stand, like an infection preventionist should be able to manage outbreaks, knowing the stages or what is involved in outbreak management. All these things are essential, and that is why I kept stressing the need to get yourself educated, get yourself familiar with the community of practice, your association, IPAC Canada. You get all these informations from time to time. There are also informations on public health website on different on the stages or and materials on how to manage outbreak. So you can have this. This is accessible. It's available online. These are informations that you can get to prepare yourself. So every organization is interested in outbreak management. In fact, a lot of other people who are not infection preventionists just conclude that infection prevention is just all about outbreak management, especially since the onset of COVID-19. And you can't really blame them. You and I know that there is more to it, but so that's a very important one, outbreak management. Another one that I know is common is isolation precautions or additional precautions. Okay, so get your information, know what this means, know when you need to what kind of additional precaution you need to put in place for different infectious diseases, those that require, those that do not require. It's a very, very common question. Another one is in professional practice is depending on the organization. If it's Ministry of Long-Term Care, for example, they could ask you what agencies are responsible for regulating our practice in that sector. So you should not miss this. For long-term care sector, it is Ministry of Long-Term Care, okay, first. And then, of course, you have public health, your public health units that provide support and other recommendations. Okay, so if you are being interviewed for infection preventionists in the long-term care sector, for example, it would be good for you to study the ministry recommendations. They are available online. They are called Ministry of Long-Term Care recommendations on COVID-19 or outbreak in long-term care setting and congregate setting. So search it up. It's been updated from time to time. Whenever you're being interviewed for a role, make sure you're prepared. If you're working in the acute sector, to know whatever resources are available for acute sector that you might need, and other hospital associations and standards that is expected. So do your own work when it comes to technicalities. Okay. Another thing is whatever background you have, it might not be directly linked to infection prevention and control. Make sure that you highlight your very strong point, like your strengths. I'll give an example. I've had to interview someone for the post of infection prevention and control, and I was not interviewing alone. There were other persons who were not infection control practitioners. Okay, and they were interested in how this person is able to resolve conflicts. Okay, fortunately for this candidate, she has had previous course. She had taken previous course in conflict resolution. So that alone, she didn't really do well technical wise, but that alone gave her like boosted her chances a lot to be considered for that show. So you never know. So blow your trumpet if you've achieved something like a soft skill that you've achieved. This is an opportunity that you can relate it to how you put it to use in your role. These are some of the advices. There are many more. If you have more contributions, if you're listening to this, you have more contributions, more suggestions for our viewers, please put them in the comment section. I would really love this to be an interactive platform. I don't know it all. So please, I'm encouraging those of us who are experienced to share with those who might be enrolling, who might be getting some interviews soon. You never know who you might be helping with this information. Please spread it. And thank you. Hope to see you again soon. Bye for now.